What to study for worldwide dental exams Part 1. Biological basis of clinical practice. First subject craniofacial biology. The notochord, neural tube and neural crest. Branchial arches and grooves, pharyngeal pouches, and the derivatives. Development and growth of the skull, mandible, palate, tongue and thyroid gland. Craniofacial malformations including developmental cysts, clefts and relevant syndromes. The histology of epithelium, general connective tissue, cartilage and bone. The histology of skin, wound healing in bone and soft tissues. Second subject applied physiology. General principles of cardiovascular physiology. Fainting, CPR. Constituents of blood. Hemopoiesis, clotting and bleeding. General principles of respiratory physiology. Oxygen carriage, cyanosis and its significance. Calcium and phosphorus metabolism, fluoride, mineralization. Hormones in control of growth, metabolism and the major body systems, metabolism of glucose. Structure and function of the salivary glands. Composition of saliva and gingival crevicular fluid, and their role in oral health indices. Mechanism of nerve conduction, neuromuscular transmission and the action of anesthetic agents. Neurotransmitters and psychotropic medication. The autonomic nervous system. Nerve damage and repair, mechanisms of pain perception and pain control. Oral sensory perception, the nature and distribution of sensory receptors in the mouth. The control of jaw posture and movement. Mastication and swallowing. Vomiting and coughing. Applied anatomy. Blood supply, venous and lymphatic drainage of the head and neck. The facial and masticatory muscles and those of the tongue, the floor of mouth and the soft palate. The cranial nerves, especially 3, IV, V, Vi, 7, IX, X, 11 and 12. Local and regional anesthesia, techniques and their anatomical basis. The anatomy of the larynx and trachea, and of the thorax in relation to resuscitation. The paranasal air sinuses. The salivary glands. Principal tissue spaces and the spread of infection from the teeth, tonsils and skin in the head and neck. Radiological anatomy of the head and neck, and especially of the jaws and teeth. Dental anatomy. The development of the teeth and supporting tissues. Dental and oral histology and the clinical applications, including tooth movement and age changes. Developmental disorders of the teeth and the dental hard tissues. Tooth morphology. Chronology of dental development and tooth eruption. The mechanism of non-carious tooth surface loss, attrition, abrasion and erosion. Forensic aspects including age estimation and identification from dental records. Functional occlusion in the natural dentition. The border movements of the mandible. The temporomandibular joint, its structure, function and common disorders.